Let's talk about acne. So it's not just a skin condition. Most often there are other triggers when we're looking at skin breakouts. Now generally we think of, oh, we've got, clogged pores, there is stuff that's topical, we need to treat just the skin. There are things we can do to help support the skin recover and heal, but we've got to look a little bit under the hood. And a lot of times we can see some gut issues, things like candida that can build up. A lot of times people will experience constant breakouts because there is an imbalance of normal flora. Candida is normal, as well as a number of other types of bacteria that we think we need to just wipe out. It's just that they've become overpopulated, or they've gone to the wrong areas in the gut and they've crowded out other good bacteria that's created dysbiosis. So specific to candida, try incorporating probiotics, because this can help bring more balance to your gut that will allow that candida to be more suppressed and more in check. We just need it to be reined in within the boundaries that would be acceptable for healthy gut flora. Now, zinc has actually been clinically studied to be supportive of facial breakouts and acne. So you can take 15 to 30 milligrams of zinc a day and see if that moves the needle for you. But that's an awesome supplement specific to one nutrient there that sometimes doesn't get connected to acne. So try zinc and see if that helps. Now, if you need to look at more herbals, we've talked about Vitex or chase tree berry, and you can do about 400 milligrams of this every single day, but this is in correlation to hormonal acne. So if you're somebody that experiences acne more in a rhythmic pattern, make sure I get that word right, but a rhythmic pattern, meaning that if you are a female especially and you've got cycling hormones and you notice that at certain weeks of the month you're having breakouts, your breakouts may actually be linked to an endocrine and hormone imbalance. So try something like chase tree berry or Vitex, give it 6 full weeks of daily use to see if that actually helps tonify, bringing balance to your hormones that you don't have the resulting breakouts. Omega-3 fatty acids are also a phenomenal supplement to help with hormones, but also to help with nutrients and supporting the liver. We know that vitamin A can be really helpful, and B vitamins for the liver to detoxify. And this actually has cod liver oil especially has the perfect balance of vitamin A and vitamin D that's going to be supportive of those detoxification factors. When we have extra toxicity in the body or in the gut, we can see that sometimes manifest in skin conditions. Other remedies could be drinking teas like holy basil or stinging nettle. Those can be really helpful again at helping with the liver, so we're supporting detoxification organs. You can also consider using topical oils for small or remote breakouts. So if you've got something that you're dealing with in your skin, you can use a cotton pad and add a little bit of tea tree oil or clary sage, or a little bit of both, and you can add that right to your skin. You may want to add a little bit of a coconut carrier oil to help so that drying out nature and the potency can be somewhat diluted. If you go straight on there, it may actually have some burning sensation, make it more irritated and more red. The oils are very, very strong. So know that you may need to dilute some things for it to be more effective. Sometimes stronger isn't necessarily better, especially if you've got something going on that is irritated already. So you can put these in a little dropper, and so if you want to add the coconut oil, carrier oil in there, and then add just a couple of drops of these oils, that way you have it, keep it on your bathroom counter. I find that that's the best way to use them. That way you're not having to mix a lot of different things around. Foods that you want to stay away from: any type of conventional dairy, sugar, anything that feeds candida, that's going to feed additional gut dysbiosis. You're going to want to pull those out of the diet. Incorporate lots of omega-3 rich foods, so lots of good meats, good fish, leafy greens, things high in polyphenols, lots of colorful things on your plate. Remove all of the processed junk. Make sure that you're doing your best to keep caffeine out of the diet. Sometimes that can create some problems for people. Chocolate sometimes can be an issue. So if you know notice that your breakouts revolve around certain foods as well, take note of that. Note the time of the month that you're having breakouts, foods that may be associated, and then look at some of the lifestyle factors, things like stress, the lack of sleep, because that's when your body's regenerating tissue. So if you're not doing that, if you're not getting enough rest, that stress sometimes can create the breakouts. We see people that have that happen all the time, even with old viruses in the body. Those viruses become active when we aren't rested and we have an increase in stress. Now, probiotics, like I said, take those on a daily basis to control the candida. 50 billion IU is a really good place to start. Vitex, this is just a recap. You can do chase tree berry and herbal tea, or in supplemental form, about 400 milligrams with breakfast or a little before breakfast every day can be great. Your cod liver oil, you can take about a tablespoon to 2 tablespoons of that, or about 2,000 milligrams, whatever the dosing equates to for whichever one you end up buying. Use some essential oils topically. And then sip on some other teas that are really good for the liver. Again, boosting some of the detoxification. If we don't address detoxification and we don't address the gut when it comes to acne, we're always gonna miss the mark, because those two come in play. And then also looking at your endocrine system too. So I hope that these tips and strategies help you as you navigate skin breakouts. Know that they do happen, but the more you can start to correlate why they're happening, which area, which organ system is deficient, is needing support, the better you're going to be able to stay on top of it, and then you'll be able to address that very factor and really start to remedy some of the symptoms of the breakouts that are not only irritating, but sometimes they can be painful for people, and really difficult for people to manage long term. So I hope that these tips have helped you. Make sure you take notes, set up your bathroom, your toolkit, your holistic medicine cabinet the next time you have a breakout.